issues. And thirdly, we have women living with HIV/AIDS. I'm sorry, women, this is supposed to be women. Women are increasingly at high risk of becoming HIV positive due to biological vulnerabilities, low socioeconomic status, dominant sexual practice of males, and epidemiological factors. Sorry. I don't want to really go into all this, but we know this is just trying to explain why women are at more risk of developing HIV as compared to male. We have biological vulnerabilities. For example, during sexual intercourse, we have more surface areas being exposed, okay, as compared to the men. Low socioeconomic status. I know some women will tell you that they started prostituting or they started sleeping around because of poor resources, dominant sexual practice of males. You can have a husband and he's sleeping with 10 other women and he will come back to you, and and so on and so forth. I don't want to go into this. Now, life for HIV infected women is never easy. They manifest profound physical and psychological consequences. Okay? Women bear a triple jeopardy impact of HIV/AIDS, and that's the truth. As the person infected with HIV, a woman bears more impact as compared to, maybe a man that has HIV/AIDS is not jeopardized as much as a woman with HIV/AIDS. As the mothers of children with HIV/AIDS, if a woman has a HIV positive child, this woman bears more jeopardy as compared to the father of that child. I'm sorry to say this. Women are more concerned about the health status of their children. So as the mother of a child or as carers of partners with HIV/AIDS, women are more jeopardized. Even as parents or orphans with AIDS, in any situation that a woman is related to HIV/AIDS, she bears more jeopardy. It's either she's the infected person or she's the one caring for an infected person. It plays out more on women. Women living with HIV/AIDS are at particular high risk of living a painful, shameful life of exclusion. Okay? Millions have been rejected from their families, their friends, and their partners. Thousands have also lost their lives, and thousands have been unable to live their lives. There is this stigma when a woman has HIV/AIDS as compared to a man. The Igbos will say "Nwoke danger." You will see a man that has HIV/AIDS. If he wants to marry 15 wives, do you know he will marry you? But a woman that has HIV/AIDS is already stigmatized. No man will even want to marry her, and so on and so forth. Okay? Or now, okay, let's assume that a woman has HIV/AIDS and she's pregnant. There are a lot of issues. The hospital will do a lot of things to see that she doesn't transfer the HIV virus to the baby, and so on and so forth. She's the one that is being monitored to avoid fetal transmission or infant transmission. But the father, who may also have that same HIV/AIDS, does not have as much interest on him. He has impregnated the woman and he has moved on. What is his business? Do you understand? So in spite of the burden of the disease, okay, the burden of HIV disease, the world is paying less attention to the issues raised by women living with HIV/AIDS. Their voices remain unheard. Okay? Since it was first identified, we all know that HIV/AIDS has been linked with sexual misbehavior and promiscuity. Everybody that has HIV/AIDS, so this person has been promiscuous. Also, this person has been sleeping around, and that's why she has HIV/AIDS. And this has contributed to the high level of stigma and discrimination associated with it. What if the person got HIV as a result of blood transfusion, or maybe sharing sharp objects in school? But you will see that once a woman has HIV/AIDS, they will say that she's promiscuous. Okay? And this will lead to the discrimination she faces. Then we have mentally ill and disabled women. Mentally ill and mentally disabled women. Mental illness affects women differently than men. Some disorders occur more commonly in women as well as present with different symptoms in women. Numerous biological differences associated with hormones and brain structure affect mental health risks, rates of disorders, and the causes of the disorders. That's why women have more mental, issues than men. And then also there are some more mental issues that are predominant in males than females, and these things have to do with biological differences. Mental disorders that commonly affect women include anxiety disorders, attention deficit hyperactivity disorders, borderline personality disorders, postpartum depression, and schizophrenia. You may want to read up these different disorders, look them up on Google to see what they are and all that, okay? Women also have higher incidence of unipolar and bipolar depression, as well as eating disorders. Depression is twice as likely to occur in women as compared to men. Early puberty is a high-risk period for specific mental disorders prevalent in adolescents, such as eating disorders. What we are trying to say here in summary is that women have a very high prevalence of mental illnesses or mental disabilities as compared to men. And these women with mental illnesses and disabilities are considered a vulnerable population, because one mental illness can lead to the other. And mental illnesses can even predispose women to the occurrence of more health problems. Let me give you an example. A woman who is going through postpartum depression, in fact I know one now that is going through postpartum depression. She doesn't eat, she doesn't breastfeed her baby, nothing, she's not happy, and she's even having more health problems as a result of the depression. It's predisposing her to more health problems. She doesn't take care of herself, she's getting ill by the day, the baby is malnourished, and so on and so forth. So she belongs to a vulnerable population. As much as some people may say that everybody has one mental illness or the other, but women with defined mental illnesses and disabilities are more vulnerable than other women. Now, women who are alcohol or substance abusers belong to a vulnerable population. Substances that are commonly abused include drugs and chemicals, alcohol, and tobacco. Intoxication results in chronic diseases, now, liver problems, hypertension, diabetes, some types of cancer, and so on. Intoxication can also lead to accidents. When you are drunk, you know what happens now, and maybe you are trying to drive a car, and in some cases intoxication leads to criminal activities. People will do things that they cannot do ordinarily, okay? But when they take alcohol, or maybe when they are high on drugs, they can do a lot of things, and at the end of the day they start asking you, was I the one that did all this? Now, smoking has been linked to chronic diseases. I've mentioned this. The use of illicit drugs like tobacco and alcohol, including riskier practices of binge drinking, is quite prevalent among women during their childbearing years. And substance use, and dependence among women is associated with poorer health. True or false? Now. It's also associated with increased stress, psychiatric comorbidities, and increased prevalence of intimate partner violence. It's true. Most of these people that do drugs, take a lot of alcohol, tobacco, and so on and so forth, they're actually the ones that, some of them actually have more issues of intimate partner violence, okay? Overseas, you see a lot of women that take alcohol or use drugs. When they get back home, they're screaming. Their husband can say, where are you coming from? He's like, get away, fuck you, all those things. Before you know what's happening, they're hitting her, they're fighting, okay? They behave, I don't know. Even on the streets, you see them fighting, they can get injured, and so on and so forth. Okay? Substance use and abuse during pregnancy may result in premature births, miscarriages, low birth weight, fetal alcohol syndrome, and places the child at risk for a variety of physical, behavioral, and cognitive problems. Now, do you see the reason why this group of women are termed a vulnerable population? Why there is focus on them? Because they are at risk of developing health issues, and they also, if the woman is pregnant, they also have increased risks as well as increased fetal risks. Women exhibiting suicide or homicide-prone behaviors are known as a vulnerable population. Hey, you know now that the rates of suicide and homicide are on the increase now, and they actually differ by age, sex, and race. Although men are 4 times more likely to die from suicide, women are 3 times more likely to report attempting suicide. Okay? Suicide rates are highest for women between the ages of 45 to 54. Although now, the rates are everywhere. Even teenagers, even primary school children are beginning to attempt that and all, and so on and so forth. And poisoning is the most common method. You see a lot of people drinking sniper and so on and so forth. Among women who are victims of homicide, 1 in 3 is a homicide perpetrated by an intimate partner. Okay, most times when people are victims of homicide, you find out that it's usually, you see a lot of, in fact, on the social media now, you see a lot of news everywhere. Husband kills this, wife does this. That's what is trending. May God help us. So this group of people, those exhibiting suicide and homicide behaviors, are termed a vulnerable population. Then women in abusive families. You know what is trending now, even since for the past 1 year or 2 now, is domestic violence. Children, the elderly, and spouses, especially women, are likely targets of violence within the family. Although older children are more likely to be injured, young female children older than 3 years of age are constantly at risk for sexual abuse in the families. Now, you see a lot of stories now, father doing this to daughter, and so on and so forth. Now, each year, women experience approximately 4.8 million intimate partner-related physical assaults and rapes, almost twice as many as experienced by men. Women are the ones that suffer most from domestic violence as compared to men. And you find out that about 70% of deaths resulting from intimate partner violence are women, while 30% are men. These numbers underestimate the problem, since many acts of intimate partner violence are unreported. This is even we have many unreported cases. You know that so many people won't talk about the abuse they are experiencing in their marriages. Everybody will come out on social media and tell you that she's married to the best man, or he's married to the best woman, and so on and so forth, and everybody is pretending to be happy, whereas the night before she received beatings from her spouse. So these women in abusive families are termed a vulnerable population. Okay, if not for anything, we know the story of Osinachi and so many other persons that have gone as a result of being in abusive families. So right now there is a lot of focus on this population of women. Okay, but we shouldn't also be a party to those that are instigating abuse in families. I know that because there is a lot of interest in women in abusive families now, people are becoming unable to be to tolerate one another. Any little thing now, they will say, come out, even if he doesn't beat you, he's abusing you emotionally. We should also remember that marriage is not a bed of roses. There can be one problem or the other, and that doesn't mean that because you have 1 or 2 issues with your spouse has made your family a highly abusive one, and I can't stay anymore, and you run away. But then there's a lot of interest in people that are undergoing violence in their homes, depending on the type of, no matter what type of violence. Okay, don't do everything, learn to speak out, all those things that we hear now. Well, now homeless women belong to another category of vulnerable population. Women who are homeless are likely victims of domestic violence. Many have experienced severe physical or sexual assault perpetrated by an intimate partner. Sometimes, most of these homeless women were pushed out on the street as a result of intimate partner related issues or domestic violence. You've seen women that ran away from their homes, or they carried their bags and ran away, and they start living on the streets, because they're having issues with their husbands or their husbands' people, and so on and so forth. So this is one of the things that can make women homeless. Now, you also find out that even those that lack social support are also termed homeless individuals, because most of them live in isolation. They live on the streets, and they don't have anybody to run to and all that. Homelessness has a severe impact on the lives of people. People who are homeless suffer disproportionately high rates of other chronic diseases and communicable infections. Now, they have poorer mental health than the average person, and are more likely to engage in substance abuse, yes, and are frequently the victims of violence. A lot of things happen on the streets. The people that live on the streets, a lot of things happen there. Furthermore, homeless women are victims of domestic violence. And they frequently suffer from anxiety, panic disorders, major depression, and substance uses. Another group of women that are vulnerable are immigrant and refugee women. In some countries like the United States, majority of immigrants are females and are more likely to be older and widowed, divorced, or separated than immigrant men. You know what immigrants and refugees are now, okay? People that are moving from one country to the other, especially these illegal immigrants. Even the legal immigrants still face one problem or the other. And they are more likely to be unemployed and live in poverty than native-born women. Immigrant women are among the most vulnerable and exploited people in American society, as well as other societies. They are largely voiceless, isolated, and afraid. Frequently, immigrant women don't know their rights. That's the truth. Because okay, for example, if someone migrates to a particular country from Nigeria and they go there, because they know they're illegal immigrants, or even if they're legal immigrants, they know that I'm not really a citizen of this place. They keep quiet even when they're maltreated. Sometimes they don't even know their rights. Okay, they tend to swallow everything that comes their way, and are vulnerable to abuse. Okay, exploitation, sexual harassment, and sexual violence. Many immigrants and refugees arrive with both infectious and chronic conditions, and that's the truth. In the process of migrating, people tend to contact a lot of infections or may develop chronic conditions, and it's not even as if that when they get to those destinations they have quick access to healthcare or even adequate access to healthcare. Healthcare for women who are immigrants, refugees, and temporary residents is complicated by diversity of languages. It's true. Some of them, for example, if a woman migrated to China and she doesn't know how to speak Chinese language, she may not want to go to the hospital because she doesn't know where to start from. Okay? Some of them also have differences in health practices, in food choices, in culturally based definitions of health. In your society, maybe if you have malaria, for example, you're coming from Nigeria, you have malaria, wow, you say it's just malaria. If I eat one or two things, it will clear from my system. Sorry, but when you go to the US or maybe to the UK, malaria is not as simple as we treat it here, or as simple as we see it here. Malaria is a more serious issue there. Do you understand? So this is what we mean by culturally based definitions of health. What you term serious in your country may not be termed serious in that other country that you went to, and these things affect how much health care they receive. All that. Then another group of women are lesbians, bisexual, and transgender women. We call them the LBT women. These women are vulnerable and are historically they are referred to as an underserved population. Okay, they frequently lack access to needed health care and social services. And in some countries, this is more predominant than in others. For example, some countries are beginning to accept this group of women, unlike others. For example, in Nigeria, when you say you are a lesbian, everybody looks at you somehow, or you are bisexual, or you are transgender, you know. So they are kind of an underserved population. When you even see, in fact, I just remembered last week or so, someone was asking me to recommend some person for a job, and I told him that I wanted to recommend someone, and he said, do I know him? I said, I don't know. You may know him. Oh, he's a bit feminish. He talks like a woman. You may know him. Back then when we were in school. And the man quickly said, no, please, oh, I don't want this person that is feminish and talks like a woman. Is he gay? I don't want him for my office. You see, stigma already. So these LBT women frequently experience barriers to care and services, such as lack of health insurance coverage. In some countries, they're not covered by the health insurance systems. Some of them have low income because they're not well accepted in all employment cadres. Some of them lack access to culturally competent health and social service providers. There is just this issue of stigmatization with them. They are at higher risk for diseases and conditions such as heart disease, cancer, depression, and HIV infection. And they tend to have higher incidence of smoking, obesity, and stress. This is from a particular study, but I also know that there are some research reports that say that they are actually they undergo less stress, unlike other people. Although what adds to their stress may be this stigmatization and what they undergo in the societies. But I still know that some of them tend to be happier. You know, they don't face all these issues of, for example, where, you know, the typical man and woman marital relationship where the men are dominating and the women are, you know, saying it's a man's world and suffering. Some of these group of women that are lesbians, you know, they'll tell you that in a relationship where everybody's exercising equal rights, so some of them tend to act happier and so on and so forth. Anyway, these things differ also from one person to another. Now, compared to heterosexual women, they have a higher tendency towards alcohol and drug abuse and are less likely to seek medical care and routine health screenings due to fear of discrimination or previous negative experiences that they may have experienced with healthcare professionals. Okay, you know, that's the truth. So most of them drink a lot, they abuse alcohol, and, you know, I don't know the kind of life some of them live, especially in some parts of the world. Okay, it's not as if we don't have a lot of them in Nigeria. That is even outnumbering the number of heterosexual women. But, you know, it's because we are more silent in this part of the world, so nobody tends to know your affiliation, your sexual affiliation or not. and most of them, they don't want to go to the hospitals. They are afraid of discrimination from healthcare professionals and all that. So in all, this group of women are termed a vulnerable population because they also have their own issues. And we also have incarcerated women. Incarcerated women are imprisoned women or those who are confined as a result of violent or non-violent crimes, like those in the prisons and so on and so forth. They are more likely to be of low socioeconomic status and have low levels of education. A substantial number of them have history of alcohol and substance abuse and have been victims of physical and sexual abuse. You see people that fall within this category in the prisons and so on and so forth, even if they were not doing all these things before they got into prison. When they're there, some of them begin to smoke, to take drugs, to undergo sexual abuses, even from the prison wardens and so on and so forth. They are more likely to suffer mental illness and have HIV infections. They are also more likely to suffer from poor nutrition and have elevated risk of reproductive health problems, including high-risk pregnancies and sexually transmitted diseases. Okay? In addition, they are often underserved in receiving adequate health care. Okay? So this group of women, really, they are a vulnerable population. Now, we've talked about 11 vulnerable population of women. There may be more, but we can't exhaust everything in one lecture. But these 11 groups are the main vulnerable populations that we have. Now, why is there a lot of focus on vulnerable women? Why are we paying attention, or why are we clamoring that attention be paid to these vulnerable women? This is because vulnerable women are less likely to have health coverage and may have little interaction with the healthcare system. Okay? Some of them, from everything we explained, you already know that some of them have poor access to healthcare coverage may not get to them, and so on and so forth. They are also less likely to receive recommended preventive care, including blood pressure checks, cancer screenings, vaccinations, dental care, and so on and so forth. They are also more likely to wind up in the emergency department or in a hospital. Their mortality rates are higher, okay, for conditions that might have been treated elsewhere. But because they have poor health coverage or poor access to health care, some of them, when it is now, observed that this person needs health care, by then it has gotten really bad, and nothing much can be done again, and before you know what's happening, they wind up. They're also twice as likely as those with higher incomes to have behavioral health problems. You know now, vulnerable women have more behavioral health problems, more mental issues and all that. They're 3 times as likely to be socially isolated. You know, a vulnerable woman will be socially isolated. And you know that social isolation has implications for health, okay? It can lead to more social health problems. And vulnerable women are 10 times more likely to experience food insecurity. You know what food insecurity? They have nutritional issues, they don't feed well, and so on and so forth. Okay? So these are part of the reasons why there is focus on vulnerable women. Doing and so saying, I think we've come to the end of this lecture. I want to believe you learned something, you picked something, you are well equipped, and you will now be able to identify vulnerable populations of women in your society. So I'm giving you an assignment, very simple and very interesting, and I wouldn't want you to copy from anywhere. Do these things, exercise your creativity, give it your thoughts. I'm sure that when we were talking about vulnerable women, in your mind you were already beginning to know some vulnerable women around you, you're already beginning to say that, oh, Mama DK is a vulnerable woman, oh, yeah, Nkechi is a vulnerable person, oh, and so on and so forth. So now I want you to select any two vulnerable groups of women of your choice. Maybe you can say, let me select mentally ill women and women that are imprisoned. Just select any two groups of your choice. Now answer the question, are they prevalent in your community? Are there reasons for your answer? You may want to say that, yes, in my community there are a lot of women with mental illnesses because blah 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 blah, or they're not very prevalent anyway because. Now how best can they be identified? If we want to identify these vulnerable populations of women, how best can we do that? Do you think that getting enough attention from the Nigerian government and healthcare system? That's another question. Is there need for the healthcare system to pay attention to this group of women? Give reasons for your answer. And finally, how best can they be appropriately captured and included for better healthcare? These are not things you can copy from anywhere. Write them the way you feel. Feel free to exercise your thoughts and your opinions. Okay? Thank you for listening. Thank you for being a part of this class. If you have questions, you can send them to me through your class rep.